My name is Dr. Giacono, and I'm the medical director of the CoolSculpting Spa of Long Island. That's a part of the J Spa Medical Spa of my practice. And what I want to do today is I want to take you through a basic CoolSculpting treatment on a patient who wants to get the abdominal wall reduced in the area where there's a little bit of a roll of belly fat in the lower part of the abdomen. So for those of you who don't know anything about CoolSculpting, what CoolSculpting is a device that's non-surgical. It doesn't require any incisions, and what it does is it's able to reduce the fat in selective areas all throughout our trunk and our body, including areas like the love handles and the inner thighs, the outer thighs, the abdomen, the back fat. And what we found with CoolSculpting is that with one CoolSculpting treatment, you can reduce the areas by about 20 to 25%. Some patients go on to do 2 treatments, but what it does is and Joyce, can you just hand me the probe? So what the device does is, it's interesting, this is the hand piece, and all the hand pieces for the CoolSculpting device are different. So they're shaped differently, because if you do your abdomen, it needs to be curved and shaped differently than if you're doing the area of the inner thighs or the outer thighs. And what it does is it sucks up the skin and the fat into this, almost like a vacuum cleaner. So this is like a big vacuum cleaner, and then once it sucks the area into this space, it freezes the fat. And you might have heard about freezing your fat away. This is what it does. The fat cells actually wind up getting broken and die. So without having to suck it out with liposuction, by freezing them below a certain temperature, it makes the fat die and go away, and then it gets absorbed internally into your body. So there's nothing that anybody needs to do as a result. In each area that you treat, it's about an hour of treatment. So some people will do just 2 areas, or they'll do 4 areas. Some people will stay and just freeze the fat away in 6 different areas of their body. What I found is that the people who benefit most of this are people who have failed diet and exercise. I exercise all the time and I try to control my weight with diet, but as you get older sometimes it's just not possible to keep certain areas away, and sometimes just genetically it's not possible. So that's why I think CoolSculpting is an amazing treatment. So today what you're going to see me do is mark and apply the device to a patient. And this patient, what she wants is she wants to help reduce the fat that comes through this area. The device that we want to use on this is called the CoolMax, and this is the area that it can treat. It's between these 2 little white lines. So everything from here to here, the fat will be frozen away. Now, what we do is we find the point where there's the most amount of fat accumulated, and then we center the treatment on that area. You're going to see me, I'm going to draw a line through that area on there. So this is the point where we have the maximal amount of fat that needs to be reabsorbed, and that's in the very center of the probe. And what the probe's going to do, and you're going to see this, is it's going to help roll all of this into the device, and that's the area that's going to be treated and frozen away. So now we're going to apply the device. So in order to protect the skin from the cooling, we put this protective membrane over the area. This is going to be a little cold. And then we're going to apply the device over the areas that we marked before. Now what it's doing is like a vacuum cleaner, it's sucking everything in. And then once everything's sucked in, that noise you're hearing is the area starting to be frozen. And now we're just checking that we have a good draw of the tissues into the device. And that's it. So now what happens is that you just hang out. You watch a movie, you watch some cable TV, you surf the internet, you can even bring your own music. We have iPod docking stations, and then you just hang out for an hour. And during that period of time is when all this stuff happens. Initially, you don't see the results. It gets a little bit swollen for a few days, and then by usually the 3rd or 4th week, you really start to see the area flatten out. And every week after that, from 3 weeks till about 4 months, the area just gets flatter, and even the skin tightens a little bit. It's a no-brainer treatment. You can still work out afterwards. Our patients love it. It's good, consistent results. So that's all about CoolSculpting.